elements. All right. So first of all, hi everyone, I'm Fran. I am a team member in the Mental Health Research for All project. I will be telling you about the project in a moment. Once I'm done with that, I will start telling you more about the Springboard opportunity. So I'll be sharing my screen. And if you have any questions, I currently cannot see hands up, but I should be able to see if you put your hand up. But please be mindful of the fact that I'm recording this. Okay, so welcome everyone. This is the last call of our funded opportunities for mental health research for all. I'm Fran Zanatta and I am a team member in the project. In this presentation, I will quickly introduce you to the project Mental Health Research for All, and then I'll zoom in onto the phase in which we are focusing, which is the building phase, and then I'll introduce you to the Springboard Funding Awards, which is what we're here to learn about today. I'll tell you a bit about the application process and the selection process, and then I will leave you with an opportunity for reflection, an exercise for you to take away. Don't worry, I'm not going to be asking you to complete this exercise whilst we're in this call. It's just a reflection that we have completed through the first 2 rounds of recruitment for this opportunity so that you can have a bit of a sense of supporting the thoughts towards developing your application. And then there will be time for questions and answers. So Mental Health Research for All is a 3-year infrastructure program funded by the National Institute for Health Research, the NIHR, which sits within the ARC North Thames, the applied research collaboration in the North Thames area. The North Thames area goes from central London, Camden and Islington, at the further west that we go, all the way to Essex. And because of the funding that we're proposing, we are prioritizing funding that target this region. If you want a more specific delineation of the geographical reach, you're welcome to have a look at the NIHR website, where the 15 ARCs that are disseminated across England are much more detailed in terms of the geographical reach. For this program, we aim to build research capacity and capability in the North Thames region. And how did we do this? So, as I said, it's 3 years. And the first year, which was 2021-2022, focused on understanding the local needs, particularly with regards to training and the factors that would impact capacity to engage with research. The current year is developing on the first year is an offer of different types of funded opportunity so that colleagues working in mental health can engage with research, approach research, and new research, most importantly. And the next year, which will start in September 23 and end in September 2024, will focus more on sharing and sustaining and spreading. So we have a lot of follow-up training plans, but also a very big and exciting conference in September 2024. And hopefully you'll be able to join us for that. I'm going to zoom in onto the current year, which is built, so that I can give you a bit of a further overview of the funded opportunities that we're offering. We kind of designed this with the information collected during the first year, and we noticed the importance of spreading the funded opportunities in ways that would target colleagues with different level of exposure to research. So the internships are for colleagues with limited or no prior experience of research engagement. The Springboard, the Career Development Fellowship is for colleagues who are developing their engagement with research in their career. And the Springboard Funding Award is for colleagues with prior research experience who want to either start or continue or disseminate a piece of applied mental health research that is of relevance to our region. As I mentioned before, alongside these free funded opportunities, we are offering free training that is specifically targeted and developed for mental health practitioners. And we are doing all of this with the fantastic support of our advisory group, and which is the public and patient involvement and engagement element of our thinking team. Today, we're focusing specifically on the Springboard Funding Award. And just to give you a heads up, we have a second webinar tomorrow on internships and career development fellowships in case you're interested. So the Springboard Funding Awards is a £10,000 grant, maximum £10,000. And it's a scheme that really aims to offer an opportunity to researchers who are active in mental health research or have been active in mental health research to apply for funding to either start or progress or disseminate a project in the field of mental health. And I'll be telling you a bit more about the projects in a moment. Just to give you an idea of what we've funded before, we funded scoping reviews, we funded dissemination projects that created either a plan for implementation of a tool that emerged through a piece of research, and another project developed a video for dissemination of research findings. We funded PPA engagement projects that really focused on the recruitment of the public and patient element to the project that was already ongoing. We also funded small-scale evaluations of existing mental health program and feasibility studies. So a quite broad range of activities. I think it's important for us to acknowledge the fact that applied health research doesn't have a specific definition. So it's very open to interpretation, which is great on the element of being able to reach broadly. But of course, it also has an element of complexity when it comes to understanding, does my project fit the criteria? So what we recommend when thinking about developing your project and considering whether it fits the criteria is asking yourself whether the project you're proposing generates research capacity. Is it springboarding you or this topic into the mental health research for the future? So it's really about using this opportunity as a stepping point, as a jumping off point to move forward and to expand what you're working on. And in terms of funding within the grant, this is a really interesting point that we're going to be discussing in the application process as well. But as I mentioned before, we can fund up to a maximum of £10,000 per project. And we really understand that this is a small amount, and it's to start something or to move forward or to disseminate. So it's important to consider what the grant, the budget that you're proposing involves, and also to check on our website to make sure that what you're proposing to fund is falling within what is fundable. So as per most funding, we cannot cover overheads costs. Who can apply? Anyone working in mental health in the broad sense, in social health and care professions, public health, commissioning, researchers. And the one criteria that is really important is that the applicant must be employed in an organization located in the North Thames region. So to give an example, we had a colleague, an international colleague based outside the UK asking whether they were eligible, and the answer is no. Or colleagues based in Bristol wouldn't be eligible because the organization is not located within the North Thames region. In terms of roles and who can apply, it's really broad. So we had ranging from PhD students to researchers to colleagues working in the voluntary sector and in the local authority. So really, really broad, and we're really keen to facilitate this wide opportunity. And we do that by having two different streams, and this is quite important for us. We are very keen to support emerging researchers, and when we say emerging researchers, this is a self-definition. We identify emerging researchers as colleagues who have not held a competitive research grant, and please note how the language is specifically flexible to allow colleagues to really reflect on where they are at in their career and be able to self-identify as emerging researchers if that seems relevant. For emerging researchers, the grant is exactly the same. The one thing that differs is that in the application, we ask emerging researchers to outline what kind of supervisory support, formal or informal, they will receive in order to be able to take their project to completion. So whether you might have a mentor in your team or from a partnering institution or organization, or whether you have a formal supervisory arrangement. So please do make sure that you outline that in the application. It's in question 4 of the application. For the stream B is recognized or established researcher. And again, this stream, self-identifiable, is for colleagues who feel like they've developed a level of independence and have previously held a significant or competitive research grant and have publications in the field of mental health research. And really what we wanted to do is to make sure that all colleagues have a fair opportunity to access this funding. The application process is quite straightforward. It has 3 different elements, and we have identified the elements with the support of the NIHR ADI colleagues, and we're very thankful to them for this. We have a Word document where you are invited to provide a title and overview of your project alongside 5 questions that really help us identify and flesh out what your project is about. Alongside the Word document, we are asking for submission of a CV of the team and individual. And again, we are asking that the CV is submitted in a Word format for access matters for us, and I'll tell you more about that in a moment. So we have these 2 Word documents, and then we have a demographic form, which is a Microsoft form to complete. You would have seen the one in the chat. We are asking the completion of the demographic form at 3 different points: at the point of interest in the core, at a point of application, and then at the point of awarding. And we're doing that to understand how well we are engaging with EDI matters, but also what kind of actions we can take moving forward to increase our capacity towards equitable access to research. In the application, there are, as I mentioned before, 5 different questions. What we're really trying to understand is what the project is about, what is the need, and how it addresses the needs of underserved communities. So a note from previous applications, it's really important for you to outline very clearly what are your PPIE plans, and we're very lucky that our advisory group colleagues have a wealth of knowledge with regards to PPIE plans and engagements, so they're very keen on hearing your ideas and your plans for your project. So once you've identified a clear rationale for your study, you are addressing a specific focus or responding to a specific need, demonstrate that you have PPIE plans and that you have local connections, or that a list you've identified who are the relevant organizations that you will need to work with to ensure that your research is applied in nature. When thinking about the aims of your project, this applicability link between research and practice is really important for us. And I appreciate that this looks different in different types of projects. So going back to what we've funded before, a feasibility study might have very abstract links between research and practice. but yeah, it's important for us that you think about this and that you share them in your application. It's a small grant. We are realistically going to be awarding the grant in mid-September, as the reviewing process is quite lengthy. And that means that the grant will projects will start in October, November, and they have to end by the end of June 2024. So it's a contained piece of work, and it's £10,000 only. So please, it's not about overselling what you can do or overworking yourself. It's about a smart project development. When thinking about the aims as well, please do make sure that you keep in mind the underserved element, as that is one of the key objectives for the mental health research project. We really want to understand how communities are involved, how you're going to be recruiting if there is an element of primary data collection, and what links you're going to be using. Alongside this, it's really important for us to understand how does your project contribute to mental health research in the North Thames area. And I use the word impact here with a bit of a tentative approach, because we're not thinking about are you going to be publishing in ABC publication. That is, of course, an important piece of impact for us and for researchers. But what we really want to understand is, how is this research going to be making waves? How is this going to be influencing mental health research moving forward? That is really what we want to achieve through this funding. In terms of budget, as I said before, maximum £10,000. The timeline of activities must end by the end of June 2024, and that is so that you can submit the final report to us quite swiftly in July, and we need to report back by the end of September 2024. So it's a matter of having time for reporting, meaningful reporting. I put here thoughtful budgeting because in previous applications I've noticed that there were lots, like there were some requests for quite significant amount of money for publication. And if so, we would need the publication to be open access to justify the cost for publication. And when thinking about, for example, participation to research, which is something that we've been asked in terms of eligibility before, the answer is yes. And how is that going to impact? How is that going to be making waves? If what you're asking for is to participate to a conference, it's not just self-serving. If it is self-serving, particularly for emerging researchers, thinking about how you're going to be using that and how is that going to impacting your work moving forward. The selection process, so the deadline is the 7th of August at midnight, 11:59. So the applications will be assessed in separate streams, so emerging researchers and established researcher. We're currently looking at funding a maximum of 5 to 6 projects. In terms of the selection process, we are asking for Word documents for the application and the CV so that we can eliminate all identifiable characteristics from the applications so that we can actually engage with the project and understand the project. We will use the CV only in a second phase if 2 projects come to the same level and we want to get a further understanding of who is working on this project. We have a scientific panel that is composed of both members of public and patient and researchers. And the process that the scientific panel goes through is individual reading of the application only. And then we have an initial meeting and discussion with public and patient members who make suggestions on projects that are more relevant to our local region and the needs of the region, and have strongest PPAE and impactful for the community proposals. And then these is shared in the scientific panel where researchers, leading researchers in the field, reflect on the strength of methodology and the project proposed alongside public and patient colleagues, so that the two elements kind of come together to life. We are really keen on emphasizing the fact that we won for this award to be an opportunity for widening participation and access to NIHR funding. So the emerging researcher stream does not require any prior PI experience, which is principal investigator, apologies. We welcome applications from a broad range of background. As I said before, we have funded colleagues from the voluntary sector, and their project was supported by established researchers. So I think that that is a really nice opportunity for collaboration. So a collaborative approach is always very successful. And really thinking about how the project will support mental health research moving forward in our region. As I mentioned before, we are offering peer review of draft applications for emerging researchers. So the process for this is outlined also on the website, but really it's a matter of emailing us the application, and we ask that all applications are emailed to our mailbox by the 14th of July. We will then allocate the draft applications to our fantastic members of the research partnership team. Very thankful to them for their contribution. And they'll be providing light touch written comments feed forward to enhance your application and make it stronger. So please do make use of this opportunity, as it's something we're quite excited about. We will then return reviewed applications by the 28th of July, so that gives you enough time for the deadline submission on the 7th of August. As I promised before, just closing with some questions for you to think about when applying for the grant. Really, we are thinking and trying to prioritize connections and population. We're strong believers in public and patient involvement and engagement. And this is really starting from the beginning of research. So who is engaged in the project? How did the project come about? What is the need and how is it evidence? Where did the understanding of the need come from? And how is the relevant population involved in the project? Thinking locally about the needs. Where is the project located? As I mentioned before, we have a geographical restriction to the North Thames area. And if you're not quite sure whether your location falls within it, please do by all means email me and I'll be able to support you, or check the NIHR website for delineation of the different ARC regional areas. Think about the local need and the local community and the local realities. We are keen to hear about connections that you have with community-based organizations and groups, and why. Why are you working in a specific area? And that kind of falls within the rationale of the project. As for the title, per the title of the award, this is about springboarding research. We want to understand how your project facilitates the connection between research and practice, and also what it's the contribution that you are aiming to achieve via this project. And the contribution is with regards to springboarding your research capacity and capability, and springboarding mental health research in our region more broadly. With that in mind, that's the end of my presentation. If you have any further queries, you can email me on my email, which is currently on the screen, is f.zanatta@ucl.ac.uk. At the moment, we do not have plans to arrange for one-to-one discussions, but I'll be available to address any queries via email. So please, by all means, do get in touch. I'm going to stop sharing and I'm going to stop recording.